Right, good morning guys. I'm Neil. I'm going to go through a secondary assessment survey with you. First things first though, we have no fire drill scheduled for today. The toilets are through the double doors onto your right hand side. If you can also make sure that mobile phones are either switched off or turned down, just so that we're not interrupting the presentation. So my main aim today is to go through the principles of a secondary survey. I'm then going to do a demonstration. While I'm doing the demonstration, I'm going to explain what I'm doing, give you the techniques, as well as the explanation of what I'm doing, so that when you get to your chance to do a practical between each other, you'll know the sort of things that we're looking for. Okay. Has anyone actually been involved in first aid or done a secondary survey before as part of your job or just in the past?
I've done a wee bit of emergency first aid.
Right. Okay. Right, excellent. So, the main principles. Secondary survey, it should only be done once all life-threatening injuries and conditions have been ruled out. So we have previously looked at the primary survey, check and breathing. This is the next stage. So once we've ruled all that, satisfied that the casualty is okay, we're then looking at the other injuries that go with it. Whilst carrying out the secondary survey, you need to make sure that you're talking to your casualty, especially when it comes to telling them what to do. They may not be responsive, they may not be able to say anything back to you. However, it's always important not only for them, so that they know that you're going to be touching parts of their body, also to anyone that's walking by that doesn't know what's happening, that you're keeping yourself right as well. And from my point of view, when I've done that in the past, it's actually quite good because it reminds me of what's next on the sequence. While you're also telling them, you can ask, and if they can tell you, ask them whether they have any symptoms of pain as well. Okay. The key points, you need to ask for permission. So if they are responding but they're not comfortable with you doing that, then you wouldn't be able to. At least you can have the discussion before you actually start touching them and they have no idea what you're doing. You need to make sure you're protecting the privacy of the casualty, especially. Certainly in our line of work, it is going to be in a public place. So we need to be mindful of that with any other customers coming by. You need to also importantly protect yourself. The main way we do that, and I'll put that within the slide, is using gloves predominantly. There could be blood, they could have cut themselves when they fell over, so obviously you want to make sure that you're protecting yourself as much as you possibly can. Do not move the casualty more than is absolutely necessary. We obviously, when we first come into a room, you're checking the area to make sure that you're safe and the casualty is safe. If that room isn't safe, then you are going to have to move them to make, otherwise you could harm yourself and put the casualty at more risk. So those are the circumstances where you would have to remove them. But again, if you can work easily around them and it's not causing any significant risk to either yourself or them, then you can work in that area and don't move them too much. You can also check for medical conditions or any medication that they are already taking as well. Okay. Any questions to this point with that side of it? Okay, what I'd like you to do, Kelly, if you want to lie down on the floor, I will go through a practical demonstration. As I do it, I'll obviously be explaining to yourself what I'm doing. Okay, so the first thing is we have checked the area, we know that the area is clear, so we're not going to move the casualty more. I've got my gloves on before I start. How we work it is a head to toe. So we start at the head and we work our way down. Okay, so Hi Kelly, I'm just going to start at your head and I'm going to just check your head. I should say the things that we're looking for are bleeding, bruising and swelling, deformity. If there is any evidence, what I mean by that is either drugs or needles, alcohol bottles, just broken glass that may have caused any injuries from where the casualty is as well, okay? So we're going to just check the head, as much of the head as we can. If there's any indentations, any softness, any bleeding, we then work our way around, just touching the cheekbones, the jaw. We're going to open the eyes, have a look if the pupils are dilated, if they're bloodshot. We're going to check in their ears. Again, we're looking if there is any fluid or any blood. We'll check the bridge of their nose. We're going to open their mouth, have a look inside their mouth, make sure that there's no either teeth missing, any blockage that may have caused it. We then work our way down. So, Kelly, I'm just checking your shoulder blades, okay? And then go into their arm, checking the fingers, checking the digits. You can then check the joints by lifting it gently and then just checking the movement there. Again, while we're doing all this, we're always checking, keeping an eye on the casualty's face. If they aren't able to respond, then we're looking for any signs of pain that they may indicate. Move round, we're checking the other arm, again making sure, checking the digits, and then again looking for any movement. Okay, just check the sternum, so you use the side of your hand and you just work your way down. And then checking the rib cage, any broken, you can, as much as you possibly can with regards to checking underneath the back. You put your hand on their stomach to see if that's swelling, anything there, okay? Working your way down, you gently squeeze the pelvis. Do not rock or roll it, it is just a gentle squeeze. From there we're working our way down, we're putting our hand on the top of their thigh and the side. Once we've passed the knee, we can then check the whole of the leg. The reason that we don't go in the inner top of the thigh is obviously it's too close to their genitals basically. So we can then check the joint again, so we're lifting it up, making sure all the time that we're checking their face. Again, hands on the thigh, working our way down. At any point you can say, are you okay? If you know the person's name, Kelly, or are you okay? See if there is any indication. Again, checking the knee joint, and then we can also check the ankles. Okay. Once we've done the full head to toe, as I said, there could be, looking for any evidence. We can go into their pockets and check for any medical bracelets. Anything that's going to give us any indication, okay? Once we're satisfied that there are no injuries, it is then just a case of putting them in the recovery position. So, hand closest to you, we'll go into a 90-degree angle. You then put the other hand there, and then palm to palm. You lift their leg from the knee outside from there, and then you gently, using that pivot, roll them over. Put the knee to a 90-degree angle to keep them stable, and then make sure that the airway's open. At that point, you would just monitor them. Okay. So what I'd like you to do is, Ken, if you just stay there, if you go through all that, Tom, please, and I'll. Okay, got my gloves on. Excellent. Good start.
Just going to check your head. Right, just checking your head. Okay, nothing there. Check jaw. Checking the nose. check your ears. Yep, okay. Right. So we'll try your shoulders next, wasn't it?
Yeah.
Shoulders. Okay, nothing there. Check your arm. Okay. Like that. Okay. There's sternum.
Yep.
Okay, that's fine. Ribs. Your stomach. It's okay. Then hips. Squeeze. Strength. Thighs. Legs. Is that everything?
Yep. Okay, what we'll do is we'll go through the recovery position after the break. So if you swap over and we'll just concentrate on the head to toe that.
Right, so gloves on, starting at the head. Feeling for any lumps or bumps. So I'll leave your drum. Then dialing, jawline, nose, ears, the neck, shoulders.
Good. Yep.
Sternum.
Yep.
Torso. Hips, give them a squeeze. Hang it back. Then same leg. Ankles. Right there. Movement. Did I miss any? I think so.
Anything else that you would check if, Tom, if you just sit up just a minute, is there anything else that you would check apart from along the body? Apart from the body, what else can you be looking for?
Anything around the casual?
Yep. Yep. Anything around the casualty with medical basis as well. Good. Okay, any questions with regards to the secondary survey aspect of it?
Take the stuff out of the pockets and put it to the side.
You can, yes, you can do. What I would certainly advise is that you actually have somebody with you, just as a witness, just in case you're accused of anything. I mean, it is important to protect yourself, so yeah, you can do that. Anything else? No? Okay. What kind of things, see when you were doing the head to toe, what kind of things are we looking for? Yep. Yep. Kelly?
Nothing for like 51.
Yep. Yep.
Moving. There'll be sickness or.
Yep, excellent. Deformity fractures as well. Good. Okay. that's the session done. So we've got, obviously you've been able to complete a secondary survey, and I would expect you to understand the principles of why we're doing it and how to do it properly, not only to protect yourself and the casualty as well. Okay, and the most important thing being dealing with any injuries that they may have. Okay. Any questions? Okay, well thank you very much for your time.